Health Trainer Service started off as a national initiative, and in the East Riding we were keen to get it going locally. There was the opportunity to set the health trainers off in Bridlington. Then we were able to extend the Health Trainer Service out to Withensea down the coast and to Goole. I think the Health Trainer Service as a service across the country is unique because it offers a one-to-one service, meeting people where they are outside a health environment, and also particularly people helping themselves. It helps people to help themselves. I think the best introduction to the health trainers is actually to see them in action.
When I moved to Bridlington nearly 2 years ago, I had a few health issues that I knew needed addressing, badly addressing, and I was actually in Specsavers one day and I saw a health trainer's leaflet and I was really interested. I thought, oh, I wonder what that is, I've never heard of it before. And they offer a wide range of help and advice. A one-to-one, somebody to talk to, and that was what I needed because I was amongst people I didn't know and I was by myself, newly single, and I filled in the form, sent it in, and Paula from Health Trainers contacted me, set up an appointment, and Paula helped me turn my life around.
In the sessions that I had with Leslie, we worked on motivation through support because that's what she needed at the time. The service is a very client-centred approach. We like to personalise it to where the person is at the time and focus on their need. The key thing about health trainers is that we like to make information available to everybody in the community. We like to let them know that we are available for them and to help them access services.
As a surgery, the health trainers enable us to meet a number of key performance indicators as well as deliver our responsibilities around the NICE clinical guidance for obesity. We're able to identify all of our patients who have a body mass index of 30, greater than 30, and either refer them into the health trainer service or they can refer themselves. Many of the patients will go there not only to lose weight but also to prepare for perhaps a major operation that they can't have unless they lose the weight. One of the nice things about the health trainer service is that it's a single point of contact for the patient. The health trainer can assess their needs and then refer them into the most appropriate service, whether that's an East Riding of Yorkshire Council Health Initiative at the gym, whether it's something on site at the physio department here in Bridlington Hospital. We have a large amount of vulnerable patients as well who are low-income families and unemployed, vulnerable adults who don't have much money, and because the service is free, that means they can access a service that they otherwise may have had to pay for. The time that the health trainer spends with the patient is far more than a doctor or a nurse could give during the working day. It therefore releases doctor or nurse time and gives that dedicated service to that patient at that point in time, which is then followed up and reviewed on a weekly basis.
One of the key things about the health trainer service is that it's sustainable through clients such as Leslie who have had success with our service, then going out and encouraging others through the Health Champion project.
I decided to become a community health champion because of all the help and care that I'd received. I wanted to give back what had been given to me, basically. I wanted to help others. One of the things that I do is that I go along and help at the stress management courses. I feel proud that I can bring my experiences to the table and that I can help the people on the course and advise them because I'm talking from personal experience. It's been absolutely unbelievable how my confidence has increased. I mean, you know, 2 years ago I would never have imagined getting married to the man that I'm very much in love with. And the other thing is that I would like to get a paid job. I feel that I can walk into an interview, I can sit down and I'm able to sell myself again, which was something that I couldn't do 2 or 3 years ago.
trainer now for 18 months. I'm based in Withensea, which is a small seaside town where unfortunately there's lots and lots of health issues. I'm based at the Leisure Centre and I see people on a one-to-one who want to make lifestyle changes. I've got a real busy day today. I'm seeing a client this morning, then I've got my Active in Age, which is a chair-based exercise class later on. I've got a meeting with the physio at lunchtime, and then I am in school with the kids this afternoon.
The first time I came to see Debbie, the health trainer, I was a bit nervous because I'd started healthy eating plans before and they haven't really worked for me. I usually come to health trainers once a week and meet up with Debbie. If I can't make an appointment, we'll talk over the phone or I'll email her, but it's always best to try and get to see her. That one-to-one has worked so well for me. I always bring in recipes, or I've brought in samples of things that I've made and say, oh, what do you think to this? That's one of the main things, is that I can cook things at home that are just normal. You've just changed them a bit and no one actually can tell the difference. With health trainers, they have tried to incorporate exercise into your daily routine, and I think before I always used to think of that as a chore, but I don't now. I actually enjoy it. So I go swimming, I go to the gym. I've actually joined the gym here, the Leisure Centre, and I've never really had that before, you know, where I've actually wanted to go, and yeah, it's really helped me and I would recommend it to anybody.
So the group's arrived at the exercise class. I've got my CD. Need to go.
We come once a week, we meet people, which is the big thing of it, and also we exercise. You don't do it on your own. As much as you'd like to, you just don't do it. You need to be with a crowd. We need to be with people so that you see them. And while we're doing it, we have a good laugh with each other. You're listening to people, you're learning something about other people, which if you're stuck in your home, not moving very much, you just stagnate. This stops that to a great extent. Right?
And it keeps us out of the doctor's surgery, doesn't it? Well,
to a great extent it does.
The following day, you move wonderfully. If it were more than once a week, it would be better.
Yeah.
But once a week is absolutely essential. Well, I think it's essential. Just for me.
Yes, I bring my husband to the class, to the exercise class of Debbie's, and I drop him off for Debbie to look after, and I go in for a swim to keep myself fit so I can look after him.
They come along, they do their exercises, and from what I can see, they sit for quite a long time after coffee and gossiping, and I think that is really, really psychologically doing them a lot of good.
Hello. Fine, thank you. Are you? Good. Are you busy?
Yeah,
Very, as usual. Whilst we've got the phone call here this afternoon, Juliet, I just wanted to ask you, what benefits do you think you've got from the health trainer service?
Well, it's very useful to be able to offer something to patients once they've fulfilled their physio goals. That's a group that's going to hopefully maintain what they've got from physio. They do get a lot of benefits out of the group, and it's lovely to have that there.
This afternoon I'm on my way to Withensea High School. I go there every Thursday afternoon and I see the pupils that have been identified by the school nurse as needing more of a one-to-one input and a little bit more time spending with them than she can give them.
Here in Withensea we're a very, very busy secondary school. We have a lot of students with varying issues. Some of which we can deal with, some of which we prefer to refer on to the specialists. We do that through a lady called Tracy Batty. She's our school nurse, and we make great use of our health trainers. They can spend a lot more time seeing the students on a one-to-one basis, and they can do that over a greater period of time.
I meet Debbie at school every Thursday in this room. After I got measured and weighed, we talk about what we could do to cut down on my food, what exercise I can do, and Sometimes we meet over at the Leisure Centre and brought my mum round one day and we had a chat with my mum there, and she gave my mum some leaflets what she can do as well to help me, because it's not just me who needs to lose weight, it's her who needs to help me lose weight.
The Health Trainer Service is here today in Goole just to actively try and promote and encourage those in the local community to engage and improve their general health and well-being. So the team are on board, they're actively giving out free health checks, free BMI checks, weights, measures, and it's about giving them the tools that they need to then go on and make those lifestyle changes. Goole is one of our NHS areas of deprivation, along with Bridlington and Withering, but Goole, more predominantly than the others, has a null fishing port, so with that you've got high levels of unemployment, a huge increase in substance misuse and alcohol misuse. We've also got a high level of teenage pregnancy in this area, so it's about trying to get those health messages out to the local community and give them every possible opportunity to make those positive changes. The health trainers who are on board today are all about actively engaging with the community, and their key role is to try and encourage individuals on a one-to-one as well as in groups. So it's about trying to get as many referrals as we can, and then from there they will see them on a one-to-one for 6 to 8 sessions individually. They'll set themselves goals, they'll set themselves key aims and objectives, and the health trainer will help support the individual to make those goals achievable.
When I first met Hayley, initially we had to devise a plan where I was going to lose 3 stone in weight, which was my target, because I was fat, 17 stone 2, and I had to admit that. We looked at my eating habits. I wasn't eating vegetables, I wasn't drinking water, now I am. I'm taking exercise, I wasn't before, and I feel a new man.
One of the many successful things that we do here in Goole is support clients into a 30-minute fun activity walk. After the walk, they all get to sit down, have a chat, have a tea, have a coffee, and then hopefully buddy up and then have continued support with other clients at the same time.
I have been coming on the health walks since, I think it was beginning of this year. They don't make you walk real fast or real slow. You can go at whatever pace you like. And when I recommend it to people, they say that's fantastic. They say, I'll have to try that one time. My mum's breathing has got better, and I've found that I can walk faster as well. Today I have done 7,652 steps since breakfast this morning.
One of the great things about having a vehicle like this is about being able to get out and about in the community, and one of the areas that we like to focus on is the industry, and we've been doing a lot of work recently with Howden's Joinery.
We've invited the health trainers on site to help us with the occupational health promotion and the health and safety promotion for smoking cessation, and also checking the health of the employees. Howden Joinery employees obviously have an on-site occupational health service. However, bringing something like this onto site actually gets people involved and more likely to come on board and get their health checks. Yeah, I mean, we've had the trainers on site before and the teams on site before, and it's always gone down really well. We get a good turnout. Many people come and visit, and I get some follow-up after that as well. People will come and say, I've had my blood pressure checked, it's a little bit high, can we have a look at that again? So it's all very good, really.
I love my job as a health trainer because we take a holistic approach. We don't treat problems in isolation, but we like to get an overall picture of what's going on in a person's life and either offer support one-to-one or refer them to other appropriate services, and that's why people have success.
The greatest advantage of the health trainer service is that it empowers the patients and helps them to make decisions about their own lifestyle changes.
Health trainer service has been really great. I've watched it over the last few years, and I've been really impressed by the achievements.
I think that one of the great things about the health training services is provided free of charge to everyone in the community.
Health trainers really do make positive lifestyle changes easier for all. The principles to that are firstly making informed choices, making sure that the information is universal for all. I think the other is more about making sure that personalised support is available and it's easy to access. And for me, the other is more about working in partnership to make sure that health is everybody's business.